Welcome to The Explainer. Today, we're diving deep into a fascinating bug you might be seeing more of in the lab, Bergeyella zoohelcum.
Just a quick note before we jump in. Everything we're covering today was pulled together using a Gemini deep search. If you want to see the full list of sources and dig in yourself, just check out the notebook document that comes with this explainer.
So here's our game plan. We're going to take a classic bench-to-bedside approach. We'll start with the organism itself, then get into how you'd identify it, what kind of trouble it causes, and wrap up with how we treat and prevent these infections.
All right, let's get right into it. Section 1, this emerging zoonotic pathogen.
So what exactly is Bergeyella zoohelcum? Well, think of it as a normal resident in the mouths of dogs and cats. It's a fastidious, gram-negative rod that we're seeing pop up more and more. Now, is it a new superbug? Not really. The thing is, our diagnostic tech, like MALDI-TOF, has just gotten so much better that we're finally able to spot it. So its incidence is likely way underestimated.
Okay, let's head over to the lab bench. How do we actually nail down an ID for this bug? It's got a pretty interesting backstory, actually.
The history of how this bacterium got its name is a perfect little story of microbiology itself. It started out just being called Group IJ by the CDC, basically a weirdo that didn't fit anywhere. Then, in '87, it got lumped into Weeksella, based on what it looked like it was doing. But by 1994, with genetics taking over, we realized it was different enough to deserve its very own genus. It's a great example of that shift from phenotype to genotype, from what it does to what it is.
So, you get a culture from a dog bite. What are you looking for? On the gram stain, you'll see gram-negative rods with these kind of rounded ends. It's an obligate aerobe and pretty picky, so it grows slowly on blood or chocolate. You might see these non-hemolytic mucoid colonies. But here's the big clue. It will not grow on McConkey. That's a huge piece of the puzzle right there.
Now this is a really cool diagnostic paradox. You've got a gram-negative rod that's susceptible to penicillin. What? And on top of that, it's intrinsically resistant to Colistin? I mean, that combination is just weird, right? If you see that pattern, Bergeyella zoohelcum should be screaming at you from the workup card.
And this is where we can really start to separate it from the other usual suspects in a bite wound. Look, it's Indole positive, just like Pasteurella multicida. But check out the Urease. It's rapidly positive, unlike Pasteurella or Capnocytophaga. And then you have that Colistin resistance again. That combo of a rapid Urease and Colistin resistance is your ticket to differentiation.
Of course, in today's lab, we've got the big guns. MALDI-TOF MS is your go-to for a fast, reliable species-level ID right off the plate. It's usually fantastic for this. But if MALDI gives you a weird result or no result, or if this is from a really critical site like blood or a joint, you can always fall back on the gold standard, 16S rRNA sequencing. That'll give you the definitive answer, no question.
Okay, so we've nailed the ID in the lab. Let's switch hats now and move from the bench to the bedside. What kind of infections are we actually dealing with here?
So, the most common thing you're going to see is a nasty, soft tissue infection right where the bite happened. Cellulitis, maybe an abscess, but don't let that fool you. This bug can be a whole lot more sinister. We've seen cases of bacteremia, septicemia, even infective endocarditis and meningitis. This is especially true for patients who are already vulnerable. Think liver cirrhosis, cancer, or anyone who's immunosuppressed. And get this, there was even a case documented from someone ingesting contaminated goat's blood. So yeah, it's not just about bites.
And that brings us to a really tricky part of the job. Once you've got the ID, how do you actually help guide treatment? This is where it gets complicated.
So here's the million-dollar question. How do you treat an infection when there are no official breakpoints? I mean, think about it. Neither EUCAST nor CLSI has established breakpoints for Bergeyella zoohelcum. So as a microbiologist, you can't just slap a simple SI or R on the report and call it a day. It forces us to be a bit more thoughtful.
So what's the right move? Well, EUCAST guidance is pretty clear on this. You don't guess, you don't try to apply breakpoints from another organism, you simply report the quantitative MIC value, just the number. This puts the power of interpretation where it belongs, in a conversation between the microbiologist and the clinician. They can look at the raw number, consider the patient, the site of infection, and make a smart call together.
So if we can't treat the bug specifically, what do? We treat the syndrome. It's kind of like a guideline by proxy. We fall back on the established guidelines for managing an infected animal bite, because those are designed to cover the whole gang of potential pathogens, including our guy, Bergeyella zoohelcum.
Let's look at the Dutch guidelines from SWAB, for example.
They line up really well with what you'd see internationally. For an adult with an infected bite, the first-line choice is amoxicillin clavulanic acid. The dose is typically 500/125 milligrams, 3 times a day for about 5 days. It's a great choice because it covers the whole spectrum: Pastorella, anaerobes, and of course, Bergeyella Zoohelcum.
And what about for kids? Well, the principle is exactly the same. You're still using amoxicillin clavulanate to cover that same range of bugs. The only and obviously critical difference is that you absolutely have to dose it based on the child's weight.
All right, so we've talked about identifying and treating it. But let's wrap up with what's arguably the most important part. How do we stop these infections from even starting?
And honestly, the most critical step has nothing to do with antibiotics. It's simple, immediate wound care. I'm talking about thoroughly washing that bite wound for a good 15 minutes with soap and running water. That mechanical cleaning can drastically lower the number of bacteria. After that, of course, you need a professional to take a look, assess how deep it is, and check on tetanus and rabies risk. That 1-2 punch is really the foundation of good prevention.
Now here's something that should make us all sit up and pay attention. We're starting to see multi-drug resistant strains of this bacteria in animals. This is a classic One Health problem, right? It's a powerful reminder that our health is completely intertwined with the health of animals and our shared environment. We can't just focus on one piece of the puzzle.
And that really leaves us with a big, important question to think about. With resistance starting to bubble up in animal populations, what's our role in all this? What should we, as microbiologists and clinicians, be doing to keep an eye on these things so we can get ahead of the next zoonotic threat?
I hope this deep dive into Bergeyella Zoohelcum has been helpful for you. If you enjoyed this and want more clinical explainers like it, please hit that subscribe button. And hey, I'd really love to hear from you. Have you seen this in your lab? Got any interesting cases? Drop your thoughts and questions in the comments below.